Alors bonjour, bienvenue dans Topik Konversasyon. Et aujourd'hui, bon matin, nous parlons incisier médical. Dentiste, combien nous qui payons pour le code dentiste, combien nous qui pas encore à le code dentiste, là, moi là, guilty. On ne connaît combien l'année pour le code dentiste. Aujourd'hui, nous faisons une conversation avec un dentiste qui, si ou tombe dans sa catégorie, la voilà, que nous pouvons verrouiller un petit peu, donner l'information que vous avez besoin, et ça l'endroit que vous pouvez aller, et ça dit, moun qui peut traiter tout, aujourd'hui, tout ça donne quelque chose qui en a pour faire avec les dents, gencives, la mâchoire, tout ça là, nous pouvons sortir out, soit pour raison médicale, mais aussi pour raison cosmétique. Aujourd'hui, bon matin, on a un grand plaisir pour introduire avec Dr. Visha. Yes, I said it right. I said it right. How are you, doctor? How are you this morning?
Yeah, very good.
Very good.
Going well. Yeah.
All right. Not new to the Seychelles.
That's very true. I'm visiting Seychelles for the last 14 years.
Yes.
So I come here every
So you're almost like Seychelles.
Yeah, I think so.
Yes.
I'm more of a local.
I think you don't come here to work. You come here for a holiday. Doctor.
We can say that.
Killing two birds with one stone, huh? All right. So, Dr. Visha, this morning we are going to talk about orthodontic treatment.
That's correct.
And that is a very specific treatment in terms of specialty in your field. Let's talk a little bit about your mornings before we go in. We're very nosy here on this morning show. How do you start your morning, doctor? Tea, coffee, water? And what time do you start your morning?
Yeah, I start my morning very early because okay, in Seychelles, I don't have my pet. I have my pet at back home.
Yes.
So which makes me to get up very early in the morning. I get
Okay.
up 5 in the morning. I'm always out of the
Yeah.
bed. And Seychelles also I do the same because you just go for a walk
It's a
in the
routine,
morning.
isn't it? Huh?
Sorry.
Yes.
So, and I'm a coffee person.
Okay.
So, yeah.
No
so
milk, sugar, or
no,
milk with
just
sugar?
a black coffee.
Black coffee.
Black coffee, no sugar.
Okay.
So, being a dentist, you need to be
Sharp.
take care of yourself
Okay. All right.
before giving advice to your patient. Right?
Born and
Sugar
ra-
is not healthy
Yeah.
to start with.
But it's okay.
On the morning.
On the morning. Only in
It's
the
not
morning and
healthy at all.
not any time during the day?
Yes, lunch is fine.
Yes.
Lunchtime is good with the dessert.
Okay.
But not for the dinner. So
Not for the dinner.
not for the dinner.
Do you offer something else at night? Tea?
I prefer, tea is fine in the night.
Tea is nice?
Tea is nice, yeah.
Okay. Born and raised, doctor?
I born and raised in India,
Yes.
which was a very early days.
Oui.
So then after that I moved to Singapore for a while. I did my
Okay.
education in Singapore.
All right.
So then I went to Edinburgh, Scotland to do my membership and fellowship.
Okay.
So then currently I settled and living in Oman, which is a very close to Dubai. People know Dubai.
Yes.
But Oman is a very quiet city. So I teach there as a professor in the college.
Okay.
And plus I run the postgraduate program, and here makes me to come and treat the people in Seychelles for almost 14 years.
So you have
it's-
the beauty of both worlds.
Yes.
You teach, but you also practice.
Yes, yes.
Ah.
That's really good to do that
Yeah.
because as a profession, when you teach, you keep on learning. You are becoming a constant learner,
Yes.
and it helps you to apply to the practice as well.
Okay.
So you always be on the field, what is the latest, you know.
Yes.
So you never get rusted.
So I know
that's the
you-
beauty of academician and academician.
Killing two birds with one stone, I
Yeah.
get it. But however, in Seychelles, when you come, it's only for treatment, isn't it? Treating your patients.
That's correct.
Have you ever perhaps thought of giving courses in Seychelles to the dentists in Seychelles?
Yeah, we had a plans.
Yes.
So I think it will
Are we giving a little exclusivity here?
Yeah, you can say that.
Yes.
But we are trying to do something because, as you know, the government does a lot of job for the country. So the problem in being an orthodontist, it's a postgraduate degree. So which means you need to study for a period of 3 years. So then you become an orthodontist.
Yes.
And it is very hard for a general dentist to know, like by doing a course.
Yes.
Most of the courses in orthodontics is focused on to the dentist,
Yeah.
how you can able to refer the patient to a specialist
Okay.
rather than they treat themselves.
Okay.
Because as you know, like for the human we have 2 set of teeth,
Yeah.
which is a baby tooth and a
Yes.
permanent tooth.
Yes.
So not like shark.
Which
So the
is
shark
changing every
has
now and then.
changing every time. Just
Yes.
throughout the life it's keep changing. We don't have the opportunity. We have only 2 set of teeth.
Yeah.
And the teeth eruption is extremely complex in nature. So it is always advisable to see the child at the age of 6 years so that they can able to refer it to one specialist. That's the right age to start your treatment as well.
And you've always wanted to be a dentist since childhood?
Yeah, we can say that it's kind of connected because my family is a medical family. My dad is a pediatrician, so we have a lot of people in our family into the field, so which really intend to do a profession with.
How is that on holidays? When the family meets up, is it all about
exactly
medical conversations?
Yeah, sometimes it happens, but we tend to avoid. But it doesn't last for long.
Excuse. It doesn't last for a long time.
It doesn't last for longer.
Okay.
So you end up having a medical conversation. That's
very
common.
competitive?
Yeah, it is, because it's everybody has come out with a different version of their professions. Right?
Yes.
So you end up in talking.
So you end up learning a little bit about everything else.
Here and there, yeah. So it's.
All right. So today, nous pouvons avec Dr. Visha et parler, nous connaît, il sa conversation en anglais à cause pour raison pour lui communiquer avec nous. Mais par contre, il prend sous pour gagner un petit peu plus d'informations, le ça qui peut donner nous un traitement qui permet ici c'est les pareil il dit of course il y a un traitement spécialisé côté ou capable gagner un petit peu d'informations, mais aussi sa possibilité pour contacter sa clinique qui travaille avec, ça c'est PSM Medical Clinic,
dental,
yes,
yeah.
Dental Clinic, côté capable gagner un petit peu pareil, ben des gens qui besoin si nous pouvons dire en termes de braces, arranger un petit peu, si nous capable d'ajouter cleft palates as well?
No, we do implants, lasers, cleft palate we don't treat.
We don't touch.
We don't touch.
What about the jaws?
Yeah, I can say this way: the PSM Dental offers all kinds of dental treatment.
Yes.
So starting from the cleaning of your teeth,
Yes.
and then your crowns,
Yeah.
the implants, the lasers,
Yes.
and plus the orthodontic treatment.
Okay.
Also is taken care.
La
It's a
voilà.
full package clinic.
Full package. Yeah, important pour nous Doctor, how often should somebody be going to the dentist?
Yes, Seychelles, I would tell you, it's Seychelles people take care of their teeth very well when compared to other population.
Compared to Sylvie?
Yeah.
Yes.
So we have a minimum of at least we need to put 6 months once.
Yes.
Is a must.
Okay.
Because the scaling is the basic thing you do for your teeth.
Okay.
Because of the food what we eat,
Yes.
so which leads to a lot of dental problems.
Especially, I'm a lover of coffee, so.
Yes, yeah, the stains you might get out of coffee.
And all the other bad habits that we have.
True.
Smoking as well?
Smoking, yeah. Smoking
Yes.
is not a good thing to do as well.
Yeah.
And because it leads to a lot of your gum problem and skin gum issues like that.
Doctor, you know what they say? When you look at somebody's feet, they can tell you a lot about the person's personality. But surely as a dentist, there must be jokes. When you look at somebody's teeth, it tells you a lot about the person.
That's correct.
Yes.
How I can put across to you in a simple words is, by looking at somebody's teeth,
Yeah.
we can able to conclude many diseases in the mouth.
Ah.
Yeah, what kind of diseases the individual is going to have. For example, if you see an individual with a lot of teeth,
Yeah.
which is eroded or untreated, where the teeth is not properly formed, we can say this individual might have gastric issues.
Okay.
So most of the health issues, the initial symptoms can be seen on the oral cavity.
Okay.
By studies it says we can able to say more than 1,000 plus diseases happening in the body, the initial symptoms comes on the teeth. The worst one you can see any kind of systemic diseases will reflect on your mouth.
So,
Yeah.
in simplicity, I know it's a very big word. What is an orthodontist?
Okay. Orthodontic, that's a very good question because this needs a large explanation.
Yes.
But I'll try to put it in a very simple way. See, orthodontics is something where you study the field after your bachelor's degree.
Yes.
And focus on primarily on the correction of the jaw.
Yeah.
As well as correction on the teeth.
Yes.
Why? Because most of the time the eruption of the teeth is very complex, which leads to basically the proper misarrangement of the upper and the lower jaw, which doesn't allow the patient to brush well. The second, as you know, it's very simple. The conversation, when you're having a tough conversation with somebody,
Yes.
the minute you smile, the concept of conversation changes.
It tells a lot.
It tells a lot,
Yes.
right? The smile is given by an orthodontist.
Yes.
Because we tend to design the smile of an
Now I'm under pressure.
So the smile of the teeth need to be arranged by an orthodontist.
Yes.
The earlier age you should see is at the age of 6 to 7 years.
Yes.
Not when all the teeth has been erupted. Most of the patient tend to come to an orthodontic at the age of 12, 14. So that time you got all your teeth,
Yeah.
which is arranged. Once it is come out of your mouth, so then it takes long time for you to correct them.
So should
But
we advise the parents to come during when the milk.
Exactly.
Yeah.
The ideal recommended age for a parent to come and see an orthodontist
Yes.
at the age of 7.
Okay.
So, at the age of 7, you have a primary teeth
Yes.
as well as the permanent teeth.
Okay.
So, it's combination of primary and permanent teeth.
Yes.
Lot of things we can able to correct. So, if you miss the stage and coming only to the permanent teeth,
Yes.
that's where the orthodontic treatment tend to become longer. It goes for a period of 1.5 years, 2 years of a treatment.
Yes.
So, its ideal age should be at the age of 7.
7, we encourage all parents par
Exactly.
exemple 7 ans, il âge côté les enfants, il besoin de dentiste et il encourage pas dentiste. Parce que si il veut quelque chose, pareil dit nous les aider à montrer un petit peu dans les filles qui prennent possibilité pour un les enfants nous capables faire un traitement qui pour aider à rendre les dents permanentes. Is there such a thing as overbrushing our teeth, doctor?
Yes, it is.
I mean, there's a lot of
does it.
people, we are
Yes,
very conscious of bad breath. We want to make sure our teeth, there's no plaques. So can we overbrush the teeth?
No.
No.
Overbrushing is not a good thing to do.
Okay.
There are so many, nowadays we have a lot of technology in place, you can able to watch a good video on that as well.
Yes.
But the most recommended is you should avoid using any kind of a paste with has an gel in it, because any gel in the paste is an abrasive agent.
Okay.
So which means you don't use a paste which doesn't require a gel, because your teeth can be very easily cleaned with the help of your saliva.
Ah.
Correct? The saliva is a good agent where it can able to keep your teeth well.
Okay.
Your brushing is just add on to the fact of what all the bad smell you because of your food and all those things. Your mild brushing morning and the night is more than sufficient. You don't need to be hard on your teeth.
Yes.
Because it will damage your teeth. It doesn't help your teeth.
Is there a difference between ethnicity in the types of teeth? Now, some people say, you know, certain people have very good, nice person teeth, beautiful teeth, and other ethnicity have, races have, a little bit worse teeth. Is there such a thing?
Yes, it is. It is in the world. As you know, because everybody has come from the different tribal sectors. You see sometime, like for example, there was a very beautiful race in Australia called as Australian Aboriginals.
Yeah.
So they never been to a dentist because they used to kind of food which is more chewy in nature, and wherever the race is into chewy in nature, the jaw tend to develop better. When the jaw tend to develop better, the teeth can grow better and can accommodate on the jaw without any problem. But I think you must be knowing this even in your family side, my family side. If you see a generation older than us, like our grandfather, great grandfathers, you hardly seeing them like have any kind of a tooth problem. You don't see them. There was no field of dentistry during that time. Maybe I should say that they never bothered. But
took
they
some pliers and removed them themselves with a few shots of whiskey.
So, but now because of the diet pattern, which is very drastic change, it's a lot of soft diet. Your children and my children tend to eat a food which is very soft in nature, so it doesn't help for the jaw to grow.
Now the parents listening are probably thinking, should I give them some certain more chewy food?
Fibers are one of the good things to have it always for the children and for the adult, because the fast food is not a good one to have. You see now
it's fast, but it's not good.
It's not good. So which affects your teeth, and the concept of the teeth is, which is very interesting by the nature. I would tell you, every tooth is an organ. Why it is an organ? Because it has a blood supply. It can stay within a bone, which means it is itself is every tooth is an organ. But the kind of food we eat, we destroy them just like that within a period.
Just like we destroy our heart or our liver or our kidneys.
Exactly. And enamel in the mouth is one of the hardest material that nature has given it to you. But
and still we managed to destroy it. Oh no. Probably when you look at certain patients and you're like, oh, not another one. Doctor, now we've talked about children, the age you recommend to come to start the visit to a doctor is 7. Does that apply for the orthopedic orthodontic treatment?
Yes, that's correct.
For 7 years old?
For 7 years old. From 7 years of old, we can do a lot of treatment for the children, which can avoid to have a long kind of an orthodontic treatment. When you come early, the things can be arranged much faster than when you come late.
And what are some of the reasons you've encountered over there? I mean, surely, with all that vast years of experience, you've encountered a lot of different scenarios, I would say.
Yes, yes. See, the beauty of, okay, I put across this way, the nature of the teeth also belongs to your parents.
Okay.
Belongs to your grandfather.
Is that
like
something
how
that
you have, like, suppose if you have a small teeth with your parents, you are also going to get a small teeth.
Okay.
So if the teeth is bigger in size, like how your face, hand and nose comes from your father, the teeth also comes from your father or the mother.
DNA
or
has been
from the
passed on.
DNA is passed down.
Yeah.
So now the question is, like, some parents, very interesting stories, because I am treating for almost 25 years in the field.
Yeah.
Sometimes you do orthodontic treatment for a child who got married, and now I am in a stage where I am treating her children now. So the interesting point of orthodontic treatment is, even though you treat for yourself, it doesn't mean like your kid is going to escape this, because you had a bad teeth that is stored in the gene, so it will come back to your children.
Generations
move on, but the health of the teeth can be maintained between the people. So which we call them as a malocclusion, which is the misarrangement of the teeth, which is more of a genetic in nature. It's not environment in nature.
Okay. What about certain children that we say, there's a lot of talks where they say, the bottle feeding can influence, you know, to use the pacifier as well, thumb sucking as well. All these are things that could possibly.
Yes. There are, we should put across these in a classification. There are some habits are good habits. Some habits are abnormal habits or a bad habit.
All right.
The pacifier, bottle sucking, thumb sucking, you get a lot of bite. We call them as an open bite, where the bite is opened.
Okay.
So this is, since I seen a lot in Seychelles.
Okay.
I seen a lot of patients with a young child. You see them with a bottle.
Okay.
Sucking, which leads to thumb sucking.
Yes.
And even in my practice, I seen funny stories like where you see the before getting married, I came an adult who wants to get treated because still he sucks his thumb at the age of 25.
Okay.
So he wants to get rid of that, you know.
Yeah.
So then you need to treat him with the braces.
That is the mindset as well, isn't it?
Yeah, exactly. It's a habit, right? So you need to change the habit with another habit.
All right. Change the habit with another habit, but surely a good habit.
Good habit.
Good habit. We continue our conversation this morning. Dr. Viswa from PSM Dental Clinic, ou capable aller checker par indi les enfants depuis l'âge 7 ans, il y a courage aussi tout bien bonheur pour mes enfants pour les capables de traiter. Même si on a des dents d'île, il est important pour mener, il regarder, il examiner et ça est capable de déchiffrer qui peut arriver dans les fiti et il y a fait un traitement qui est nécessaire pour aider les enfants les dents permanentes et venir pour être capable de créer un bon sourire et joli par elodie et joli l'arrangement les dents. Nous continuons la conversation aujourd'hui bon matin et voilà côté Dr. Viswa. We continue our conversation this morning. Now, what are some of the longest services? What are the span of time between certain treatments that you have on offer?
Okay. So now basically, I think if I understand the question correctly, like what treatment takes longer to do, what treatment takes shorter to do.
Yes.
Yeah.
Because you know, some patience and time frame is important.
Yeah.
You know?
So there is a saying, patient doesn't have patience.
Good one. I'm going to poach that one from you.
So it depends upon that, because there is no code to say it, right? So it's every mouth is different, every individual is different. You get an individual who is very sincere to take care of his teeth because he needs to keep it. It's in simple terms, you maintain your set of teeth so that you can able to eat well till you die, right? So some treatment, like for example, if you are doing the basic one like the scaling, which is a very common treatment, everybody does it. It doesn't take longer. You get an appointment in the clinic, get it treated in a period of 30 minutes like that. So on which you keep doing that every 6 months once. But if you have a cavity, so which needs to be filled, so which will take some time to do that. And if it's a root canal treatment, again, as per the individual, sometimes you do on a 1 sitting, 2 sitting, or a 3 sitting. The implant, again, it takes upon how many teeth we need to have it in the mouth. So it basically depends upon the procedure, what procedure you do, and how healthy you keeping your mouth.
And that's very important.
That's very important.
Aftercare aussi vraiment important. post-and-pre, capable dire, post-and-pre est vraiment important pour vous, capable de gagner un résultat que vous appréciez. Et écoute dentiste aussi, combien nous qui allons, nous demandons advice dentiste, nous demandons millions de questions. Mais après, les de la cour, nous faisons tous les contraires, nous pas écouter, nous simplement prendre sa patience pour nous aider. Nous les dents, ils font pas nous sourire, et vraiment important. Par le docteur dit, vous sourire capable de faire grande différence. First impression, yes, nous les dents. Il fait une grande différence si nous arrivons à l'endroit quand nous les dents pas trop jolis. Première conversation que nous faisons, quand dit, on est fini, dismiss nous, il va pas écouter nous, dans rien qui peut sortir de nos labous. On this note, now, let's talk about some of the treatments available. Some of the techniques that is being used available in,
yes.
At PSM.
Yeah, we have the clinic always strive to do bringing the latest technology
Yes.
to the country.
Yeah.
Simple reason because we need to serve the society. That's the primary reason we do it.
Okay.
And in terms of supporting the government as well.
Yeah.
So the clinic at par, we have all kinds of facilities to the standard. We have the X-ray which can able to do the full mouth X-ray of your teeth. And very recently we come out with the scanner, so which is the 3D scanner, so which can able to see the patient teeth instantly and able to see the changes of their teeth between the pre and the post, the corrections. So that's the latest one we have it at our clinic.
Now, right in front of you, there's a piece of technology, but before we go into that, nous pouvons sauter un petit coup pour ban Simon qui là pour exemple dit bon Sylvie, qui est numéro téléphone, qui côté mon pour aller. Avant là, nous prenons un petit commercial break, nous pour donner tout ça l'information, ou bol pen ou papier mettre paré, ou sinon mettre au téléphone paré, tiens un petit portrait, ou gagner tout ça l'information c'est au téléphone. Voilà que nous prenons un petit commercial break pour gagner tout ça l'information qui c'est sa PSM Dental Clinic et qui on peut faire où ici Cécile.
PSM Dental y introduit premier iTero-Dental Scanner de Cécile. Ça l'équipement est produit dans une image 3 dimensions et très précis où les dents extensives pareil était actuellement et la façon où la bouche pourrait garder après traitement pour redresser et aligner les dents et permettre au mode bien. Il prend moins que 60 secondes avec sa technologie révolutionnaire pour voir et exciter pour nouveau sourire après le traitement dentaire. iTero Dental Scanner est aussi servi pour faire des images précises et très vite en préparation pour mettre couronne et fausse dents. Fini ben procédé inconfortable que tu as dû étouffer. Contactez-nous ou bien visitez nos cliniques à côté cimetière Belair pour faire ça l'expérience. Code PSM Dental, nous créons un joli sourire qui paraît naturel.
Ah voilà, un joli sourire. Si maman c'est mon besoin de dentiste, mon besoin. Mais moi après moi, I need to put an appointment with the doctor. I'm pretty sure I have a lot of issues in my mouth. But back to our conversation.
Yes, please. Yeah.
There's a nice piece of instrument in front of you, a nice piece of machine in front of you.
Yes, that's correct.
Yes.
So this is a beautiful equipment. I think it's called iTero.
Okay.
It's a 3D scanner, so
Okay.
which help you to see your teeth. Like basically in olden days, what we used to do is we need to take the impression of the mouth,
Yes.
convert
the
them into a
molds.
mold.
Yes.
So then you study the mold.
Okay.
So now we have the data here,
Okay.
which help you to read about the patient's mouth even when the patient is not there.
Okay.
So which help you to see in whatever the way you want to change your mouth.
And that is
we
good
can
for you.
able to that. It's excellent. It's like
Because
excellent
even if the
innovation
patient-
in
yeah,
science
I
and
see.
technology,
Yeah.
which makes the time shorter
Yeah.
for a doctor. And it's not only that, it help you to understand the problem of the patient really well, because you see and you take a picture
Yeah.
to the stage, but still this something gives you the whole of your mouth in front of you, right?
Okay.
So as a dentist, you feel this is a very important tool to come out with the best treatment plan
Yes.
for the patient well-being, right?
Et voilà,
So-
pareil, nous voilà le screen. Là, il y a ça portrait, côté peut montrer un petit peu qu'il y en a, qui a une facilité. Pareil, il dit, ça morceau, l'équipement, il scanne un petit peu la bouche, et voilà, côté il y a ça portrait l'image de la bouche pour donner un plus bon images, qui est pour adapter au traitement, et qui est pour traiter la bouche, et un petit peu plus vitement aussi, pour faciliter le traitement. Pareil, nous voilà, voilà. Devant lui, ça marche. But this is the screen. How do we get into the mouth to take the picture?
Yeah, it has an attachment on the side, which
Okay.
we did fix it over there.
Yes.
It's like a size of an.
Is there
like
something
a
that goes into the
torchlight.
mouth to take the
Yeah, you scan through your mouth.
Okay.
So it's a small tool which
Yeah.
takes the multiple pictures of your mouth.
All right.
And make a design. I can able to show to the
Yes.
people if they want to see that.
Yes.
So now you can see it here, that's a patient
Also,
jaw.
you can turn it, you can
Yeah,
manipulate the
I can turn
image.
it, I can make it, I can zoom it, I can expand it.
Oh.
So like, so for example, you can see this particular individual where you can see the tooth has been blocked here.
Yes.
So which is creating a problem.
Is that a common problem in facials?
Yes, we can see that.
Yeah.
This is called as a crowding
Okay.
or an impaction. So
What
which you see
causes
it,
this, doctor?
again we go back to the old conversation.
Yes.
The pattern of chewing. So if you have as a child, when the child is not used to the good fiber eating food, so the jaw tend to smaller. Why? Because the brain understand you don't need it.
Okay.
So then you have a jaw smaller,
Yeah.
the teeth will become, doesn't have a space to come.
So I know certain parents when the baby hasn't even, gotten any teeth, but they've got the chewing toys. Is that good or bad? What are your thoughts on this?
That's a different, actually that is, actually pediatrician will be a better person to say on that.
Okay.
But again that is need to be really taken care well.
Okay.
Simply because if you have a teeth in your mouth and
Yeah.
if a child is born normal, the kid will have a teeth.
Okay.
Whether you need to give that or you don't give
Yes.
that, the teeth is going to come.
It's gonna come.
It's going to come.
Okay.
You cannot avoid that, So that is an add-on. Maybe it will help the child to avoid any kind of an irritation when the tooth erupts.
Yes.
So that's the reason you give that.
Yeah.
But again, you need to be careful with this kind of toys. It's more of a plastic in nature.
Yeah.
So and the sterilization, hygiene comes a major role. Just back to this now. So if you see this structure here, and there is a way where even I can able to
Oui.
see the X-ray of the tooth as well.
Yes.
So this is called as an infrared imaging, where I can able to predict the patient with the less kind of a cavity which comes initially. You can see it on the two screens here.
Yes.
So it's not only that, it doesn't stop there. So again the options will give for me to even study the gums of a teeth. You can see there by putting an image, we can able to see the gum.
This is where you diagnose other issues that is pertaining to your mouth.
And plus again we have another option where this is a bite. So basically when you bite, generally you don't bite on your front teeth.
Yes.
It's called incisors. You incise it.
Okay.
So you need to bite only on the posterior teeth at the molars where you can see it there. So now this particular individual, you can see they are biting it in the front. Can you see it here?
Yes.
So the model can able to give you even the design where exactly the bite problem as well. So you can see it, these are all the area the individual is biting.
Yeah.
So and again you can get a mark on the lower teeth as well.
You can
So
basically have the journey of a life. You can write the biography of the person's life based on the images of their teeth.
So where all you are seeing red is a problem.
Yes.
See now this technology will help you to understand the bite of an individual, the gum health of an individual,
Okay.
and as well as the tooth health of an individual.
This must be your best friend.
Yes, this is one of my
This
best
equipment
friend
is
now.
your best friend.
Yes, I need to sleep with it.
Doctor,
yeah.
so all of this is what is on offer at the PSM
That's correct.
dental clinic, whereby you get access to the information, you can manipulate the information and have a thorough diagnosis of the individual. Now, let's talk a little bit about what this entails. Technology in your line of work, in your field of work, how important is it?
It's extremely important being a doctor.
Yeah.
Because there was a day where you used to do a dentist without using a lot of technology.
Yeah.
The dentist demands technology because it's a field where needs a lot of innovation simply because you need to come out with a good material on the mouth because it's going to be in your mouth which doesn't cause any kind of a problem, right? So, and you need to replace an enamel, for example, you are replacing with an enamel with a more harder artificial material in the mouth. If I don't do that, again it is not going to help the patient. The treatment for any dentist should focus on treating a patient with a proper diagnosis so that the patient doesn't come back to you again in a good way. So that you do a good job.
They
so
come back to you just for the routine checkup.
Yeah, exactly.
And nothing else.
Nothing else.
Okay.
You come back for a routine checkup. You don't come back to redo your treatment. So that's where the technology will help you to fix all your problems. Sometimes, I think it is a beautiful saying, matches with everyone's life. Change is constant in life.
Yes.
Rest all.
Yeah.
So it goes to my profession as well. So I studied in a time where the technology was not there. So now I need to learn this
Yeah.
so that I can be at par with the technology to help the patient. Right?
Now, let's go back to your teaching
Yes.
part of your life.
Yes.
Looking back through the years, yourself in university, starting off and deciding to become who you are today, and when you look at your students, the comparison between the generations of students, are you satisfied? Is that a good I don't know if I'm happy with that smile.
It's more of a political question. I don't know how to answer that. So yes, yes and no. See,
Yeah.
always I put my graph in a way in teaching.
Yes.
You get a set of 10 students.
Yeah.
You have 4 are good. The 4 needs a help.
Yes.
The remaining 3 is going to really drag you down.
Yes.
You know, it's like a bell curve, you know, it's always you have that. But now technology is really helping the younger generation than
Yeah.
us, because sometimes they are faster than you.
Yes,
That's
very
what I
tech
can
savvy,
tell you.
aren't
They are tech savvy, they
Yeah.
can able to do things faster than you.
Yeah.
But all said and done, experience matters.
Yeah.
So
When you the using of the
yes,
hands.
Yes, experience matters.
All right.
Yeah, because without experience, even you have the technology,
Yeah.
you don't have the experience, you don't last long in the.
You can have the brains, but if your
Yes.
hands can't do what your brain is thinking,
Yes,
then it's
exactly,
a
yeah.
different story.
Yeah.
What word of advice would you give young people watching? Perhaps they're thinking of taking a job as a dentist. Of course, there are specialized treatments, specialized fields, where they can venture in, but at one point or another, they have to start with the basic.
That's correct. Yeah, but Seychelles have a lot of potential for the local dentist to train on, and it is very good, to be frank, with suppose if you compare the medical and a dental field.
Yeah.
Dental field gives some lenience for it to work, because he don't have an emergency to deal much.
Yes.
So you have a piece of work,
Yeah.
and if you like art, which is a very basic of dentistry, dentistry is defined with arts and science.
Okay.
So if you are good at your artistic skill,
Yeah.
you can be a good dentist. If you are not good at your artistic skills, it's very hard to be a
So there needs to be
dentist.
that fine balance.
Yes, it need a fine balance, because eventually the mouth is one of the most sensitive part of a human body.
It's a canvas, isn't it?
Yes. So you need to be very careful when you deal with your patient. If you don't
Yes.
have a very soft hand and the soft skills, and it doesn't help you to be a better dentist.
I'm assuming you have soft hands.
I think so. It's 25 years over.
Doctor,
25 years
something
counting. Yeah.
that's been picking up lately, cosmetic surgery in the mouth, in terms of jewelries, etc.
Yes.
I mean, we see celebrities doing it, and we have facial arts doing it nowadays. How good or bad is that?
I would put you in simple words. There are many kinds of cosmetic works.
Yes.
They do something called as veneers, like your skin of the nail, like that, like
Yeah.
a nail cover, or a laminates.
Okay.
And they do the jewels to
Bleaching
make
of the
like
teeth?
bleaching.
Yeah.
All you can do, but it cannot meet with your natural tooth.
Yeah.
So it's better to be with your natural tooth
Yes.
rather than to create
Take care of the
artificial
original
ones.
ones.
It can help you, but it doesn't help you forever. So
What
it's
about
like
Yeah.
it's like constantly you keep doing this over a period of time,
Okay.
6 months. Keep repeating what you are doing,
Yeah.
like your facials or your skincare.
Exactly. Like every other part of your body, you take care of it. It's important as well. What about the jewelries that I see? Is that
They do.
on the tooth or in the tooth?
It's on the tooth with the help of a glue.
Okay.
It doesn't stay for longer,
Okay.
because if you eat something hotter, it'll come out.
Okay.
I think jewelry on the hand is better than on the teeth.
Yes. Let's just leave it off the tooth. All right.
Exactly, yeah.
Doctor, anything we've covered so far, we've not covered so far, is there anything you would like to share with us this morning during our interview? Of course, PSM Dental Clinic, moi pousi sa zote, que tu capable de un petit call pour gagner sa l'information, pour mettre apprêtement. You're not here in the country all the time.
That's correct.
You come on...
How
often are you coming?
I come every 6 weeks once,
Okay.
but eventually the people can able to make an appointment and the clinic will take care of the
Yeah.
patients well in advance.
Yes.
So Seychelles is a very friendly country. It's almost 15 years up for me. I treated a lot of patients in the island. And
You're just one of the locals now, doctor. You're already sensual right now. 15 years, you're already sensual.
Yeah, thank you for having me here and doing a wonderful interview.
It was
Thank
an
you very much. Pleasure
interesting.
meeting you.
Thank you. It was an interesting conversation, but I can't leave without asking you this. Have you tried the local food?
Yes, I love Creole food.
Yes.
Yeah.
What is some of the things you've
experienced? I like the fish
experienced?
in Creole. The fish is
Fresher.
yeah, fish is really fresher. You won't get this anywhere.
So they're treating you good when you come to Seychelles?
Of course.
They
I have a
feed
lot
you
of
well.
good friends. They take care of me really well. So I don't have any
Any issues?
any issues at all.
Apart from work, any time that you're going to come back for a holiday and not work?
Yeah, I think that is doubt, kind of.
Maybe when you retire.
I think so.
Are you
Maybe.
preparing for retirement, doctor?
It's too early. I'm still young, actually.
Still young?
Still young. Long way to go.
Long way to go.
Long way to go.
What is the maximum age that you can push the limit for
See, I
dentistry?
have blood of my father. My father is 78 years old. He's a pediatrician still practicing.
Yeah.
So I don't know. It's doubt. I won't survive a day without working, actually. Let me put it this way.
Dr. Visha, it was a pleasure meeting you this morning. And of course, mesdames et messieurs, numéro pour call pour PSM Dental Clinic, oui, bon, dans sa numéro, 432 43 44, 432 43 44, et numéro qu'on capable call sont ouverts depuis lundi, mardi, mercredi, jeudi, vendredi, samedi, mais dimanche sont fermés et sont ouverts depuis 7h30 pour matin jusqu'à 3h30 après-midi, ou capable call pour mettre un appointment 432 43 44 PSM Dental Clinic, que tu capable pareil nous dit faire sa parcours, regarder un petit peu dans la bouche, get un petit peu de problème, et s'il n'y en a aucune nécessité, il y a un traitement spécialisé qui Dr. Visha avec son team est capable. Doctor, any final words? I've cut you off last time. Any final words before we wrap things up?
Take care of your teeth. That's it. It's a very simple words.
Very simple. Nothing more. Short and sweet, to the point. Take care of your teeth. Prends care avec vous les dents, mesdames et messieurs. Il y a quelque chose, ça partie ou les corps qui est une bonne substance plus fort dans les corps. Mais somehow, pour les raisons ou une autre, nous still manage pour nous dommager les dents. Nous souris, ils font pas nos figues. Et nos figues, il y a un canvas qui dit, il représente nous, il nous l'identité. Nous ID card, nous passeport, nous peut travel partout. So, at one point or another, des conversations où les dents, ils font pas sa conversation. Et pareil, docteur dit, prends cas pour les dents. Il a fait ci qui a ouvert beaucoup d'opportunités dans la vie, qui fait qui. A visite au dentiste every 6 months, you said, doctor, right?
That's correct.
Every 6 months at least, nous faisons un petit rendez-vous et c'est pourquoi que mon pour dire où, qui dernière fois qu'on t'a au dentiste, qui dernière fois qu'on prend cas pour les dents, 432 43 44 PSM Dental Clinic, call line, femme et toi appointement. Ça, c'était notre conversation pour aujourd'hui bon matin.